Welcome to the Pulmonary Rehabilitation Education Sessions. This is a series of educational sessions on how to manage your condition. We'll be covering 5 topics. These include managing a flare-up, managing breathlessness, mental well-being, the benefits of activity, and medication for your lungs. This is session 4, and we will be discussing the benefits of activity. It has been shown that physical activity has a positive effect on mood. Exercise or activity releases feel-good chemicals such as endorphins and serotonin, and these improve your mood and make you feel a little bit happier. Sometimes if you're doing exercise with others or going for a walk, then that social interaction can get you out of the house and put you in touch with other people. This can help to reduce any feelings of loneliness or isolation that you might be experiencing. Activity involves movement, and this requires muscle power. Frequent muscle contractions will start to strengthen the muscles. As your muscles become stronger, then they are better placed to stabilise the body and respond quickly, which improves your balance. All of this, stronger muscles and better coordination, will help to prevent falls. There are a variety of adaptations and starting positions for the exercises that the therapists provide as part of the pulmonary rehab. So if you're concerned about your balance, then the therapist can adapt your program and perhaps start you in a seated position. As you become stronger, you can gently challenge your muscles and reduce the amount of support that you need. Let's talk about diabetes and cancer. So physical activity lowers sugars that are found in the blood. Some sugars are broken down during exercise to provide energy needed for that activity. As these sugars are broken down, it will lower the amount of sugars that are in the blood, and this lowering of blood sugars can improve type 2 diabetes. There has also been some research into the effects of exercise on some cancers. Some research states that it's possible that exercise can cut the risk of colon cancer or bowel cancer. This is because it's believed that exercise can reduce insulin levels in the blood, and it can improve the immune function. Another possibility is that exercise, because it helps to speed up the passing of food through the digestive system, then some cancer-causing chemicals found within certain foods are passed through much quicker and have a smaller chance of being absorbed. Other research has shown that exercise can affect breast cancer risk. Although it's not fully understood how exercise decreases the risk of breast cancer, it is thought that perhaps because exercise helps to reduce the body fat, then consequently this would reduce our risk. Physical activity has a positive effect on the brain and sleep. Activity pumps more blood up to the brain through circulation, and this will help you to think more clearly. Your memory can also be improved because exercise helps to increase the size of the hippocampus, which is part of the brain that's responsible for memory. As the connections between the nerve cells and the brain are also improved with exercise, then this will help with your memory and also protect your brain against injury or other diseases. Some recent research states that exercise can delay the onset of Alzheimer's and also reduce your risk of vascular dementia. Exercise might also give you a better night's sleep, as it helps to improve the quality of sleep and the length of sleep that you had. But because of the benefits of exercise in reducing stress and it can be quite physically tiring, it will also bolster your sleep in that way. Physical activity can help to manage your weight. This is in conjunction with a healthy, balanced diet. Being a healthy weight will help to reduce any chances of you developing type 2 diabetes. Or if you have already been diagnosed with type 2 diabetes, a healthy, balanced diet and weight may help you to manage that condition better. There's also been evidence and research to support that weight-bearing exercises, these are exercises in which you are upright, such as walking or exercises in standing. So if you do weight-bearing exercises, then this can increase your bone density. If you have a good bone density, then you are reducing your risk of developing a condition called osteoporosis. Osteoporosis is a condition which weakens your bones so that they may break more easily. This is particularly important for women who are postmenopausal. A low estrogen level also increases the risk of osteoporosis. So therefore, weight-bearing exercises and a balanced healthy diet will help to reduce the risk of developing osteoporosis. As well as benefits to the lungs and the breathing, exercise also has benefits to your cardiovascular, so your heart and your circulation. Activity helps to lower bad cholesterol, and it also raises the good cholesterol that's in our blood. It can lower our blood pressure. It can help to control diabetes, as discussed earlier. It's also got benefits of controlling weight, and it can help to reduce stress. All of these risk factors for heart disease and heart attacks or strokes can be reduced by exercising regularly. This diagram was produced by Public Health England in the Health Matters Getting Every Adult Active Every Day campaign in 2006. It demonstrates what are the health benefits of physical activity. The diagram illustrates the benefits of physical activity regularly, and this helps to reduce the risk of mortality by 30%, so that's death. Also helps to improve the risk of cardiovascular disease, so heart disease, by 35%. It helps to improve the risk of type 2 diabetes by 40%, to improve the risk of bowel cancer by 30%, by breast cancer by 20%. It helps to improve depression in up to 30% of people. It helps to improve the risk of breaking your hip in almost 70% of people. And it can help to reduce dementia in 30% of people. All of these health benefits of activity relate to if you do exercise or activity regularly throughout the week. It's recommended that an older adult should perform 150 minutes of moderate exercise each week. By moderate exercise, we mean that you're working hard. At this level of exercise, you should still be able to talk, although taking some bigger breaths whilst talking, and you might need to take some breaths throughout your sentence. Talking but not singing. These 150 minutes can be broken down into 5 sessions, each of 30 minutes duration. For some people, however, 30 minutes might be a little bit too long or too intense, and they can break it down further into 10-minute bursts throughout the day. So what types of physical activity should you be doing? Well, it's recommended that you should do a mixture of aerobic, which is like cardiovascular exercises, and also strengthening exercises. The NHS suggests that adults over the age of 65 should aim to do some form of strengthening exercises on 2 or more days of a week. These strengthening exercises should target all the major muscles, all the muscles in the legs, the hips, the back, the tummy, the chest, the shoulders and the arms. And when you combine the strengthening and the cardiovascular or the aerobic exercises, it's one of the better ways to help people stay strong and fit and healthy. Your exercise programme from pulmonary rehab therapists should include this principle. You will often find that you would alternate between a cardiovascular exercise and then a strengthening exercise. Physical activity comes in many forms. It could be hoovering, could be gardening, could be walking, running or looking after the grandchildren. As long as the activity is for a minimum of 10 minutes and you get moderately out of breath, then this is counted as exercise and would be of benefit to you. It's best if you enjoy it, so trying to think about an activity that you enjoy doing, like dancing or crown green bowling. If it's an activity that you enjoy doing, then you're more likely to stick to it and to do it regularly 5 times a week. It doesn't have to always be in the form of a structured exercise circuit. So when you're starting your pulmonary rehab, have a think about what it is that you enjoy doing and what it is that you're going to do to make sure that you maintain regular activity throughout the week. We hope that you enjoyed this session and can see now the benefits of doing regular exercise, not only on your lungs but also on your bones, your muscles, your heart, your circulation, your mood. Our next session, session 5, we'll be discussing medication that's used in helping to manage your lung condition.